How's it going, everyone? Today we're going to finish up our discussion on the endocrine system. And so before we get into the rest of the organs and hormones which make up the endocrine system, let's review from last time. Remember that hormones are chemical signalers that are going to travel throughout the bloodstream and then bind to specific receptors located on certain cells. And the way that we can influence different mechanisms and different functions of our bodies are through these hormone levels. So if we want more of a specific event to occur within our bodies, we could change the level of hormone, or we could change the number of receptors that are located on cells. And hormone levels are going to be dictated by nervous activity, certain mechanical stimuli, chemical levels or ions located within the blood. And then, of course, other hormones as well will regulate the secretion of hormones released by certain organs. And then we also discussed that part of the reason how these hormone levels are regulated are through the hypothalamus. That part of the brain is going to be the master regulator of the endocrine system and directly influences both the anterior and posterior pituitary gland. First, let's discuss the thyroid gland, which is a butterfly-shaped group of cells located on the larynx here in the trachea as shown. And there are two different cell types located on these group of cells. Follicular cells, which are going to produce the hormones T3 and T4, and then parafollicular cells, which produce calcitonin, which is going to regulate our blood calcium levels. Many cells throughout the body have receptors that T3 and T4 bind to, and when those hormones bind to cells, it upregulates protein synthesis, and so that is heavily tied in with cell growth, but it also increases our basal metabolic rate, and so it promotes aerobic metabolism and the breakdown of triglycerides, the promotion of gluconeogenesis, and the breakdown of glycogen. And so all of this will help to increase our metabolic rate and help provide energy in order for cell growth. The amount of T3 and T4 that is released into the bloodstream is going to be regulated by their levels within the blood. And so if their low levels of T3 or T4 or metabolic rates are low, what's going to happen is the hypothalamus is going to secrete TRH or thyrotropin a releasing hormone, and then that will make its way to the anterior pituitary gland where those thyrotropes are going to release thyroid stimulating hormone. Thyroid stimulating hormone will make its way down to the follicular cells of the thyroid, which then is going to stimulate the release of T3 and T4, and then again, those levels are regulated. So if that T3 and T4 now starts to be released and that's going to start to increase, well, then at a certain point, it's going to reach a level where then the negative feedback loop is kicked in, and then the hypothalamus will not produce as much TRH, and then that will lead to lower levels of TSH and then T3 and T4 being released from the thyroid. In addition to regulating metabolic rates and cell growth within our bodies, the thyroid gland will also release calcitonin, which lowers calcium within our bloodstream. But also embedded within the thyroid gland are these groups of cells called the parathyroid glands, which are going to release what is called parathyroid hormone, which is going to have the opposite effect on blood calcium levels. But parathyroid hormone is also going to play a role in regulating magnesium levels and then hydrogen phosphate levels within our bloodstream. Here we can see the effects of calcitonin and parathyroid hormone on our blood calcium levels. If there's a high amount of calcium within the blood, then more calcitonin is going to be released by the thyroid gland. And what's going to happen is then calcitonin is going to inhibit the activity of what are called osteoclasts. And these are cells that are going to break apart the extracellular matrix of our bones and release calcium within to our blood. And so calcitonin decreases that activity, thus decreasing calcium levels. However, if there's low levels of calcium within the blood, then parathyroid hormone is released by these chief cells of the gland. And the parathyroid hormone will promote release of calcium from that bone matrix into the blood, and also slows down our calcium loss through our urinary system. And also a secondary effect is that parathyroid hormone is going to stimulate the release of what's called calcitriol, and that's going to increase the amount of calcium we absorb through our food, and therefore we are then going to increase those blood calcium levels. Next, we have the adrenal glands, which are located on top of the kidney, and like the thyroid glands, it has different groups of cells that are going to release different hormones. We group the layers of these cells typically as the inner or medulla, the adrenal medulla, which produces our catacholomines that we were discussing earlier, dopamine, norepinephrine, and epinephrine. And then we also have the outer adrenal cortex, which is going to produce other hormones. The adrenal cortex is going to contain 3 different groups of cells or zones that each are going to release their own types of hormones. And so we have mineralocorticoids, which will maintain the mineral levels of our blood, the glucocorticoids, which regulate glucose metabolism within our bodies, and then androgens, which are steroid hormones that have masculinizing effects. The adrenal cortex will also regulate our blood pressure, and it does this through a process called the renin-angiotensin aldosterone system. And I do want to just highlight it for a second and just bring it up and just let you know that this hormone aldosterone leads to increased blood volume and increase in blood pressure. But since we are going to be discussing blood pressure in, upcoming chapters when we discuss the cardiovascular system, I'd rather talk about the whole system and the whole pathway there. So for now, just keep in the back of your head, aldosterone leads to an increase in blood volume and blood pressure, and that it's released by the adrenal cortex. But again, we'll discuss this pathway more at a later date. Glucocorticoids are a class of steroid that our adrenal cortex produces, which have impacts on not only our metabolic rate by increasing metabolic rate and the breakdown of certain materials to get glucose, but also have an impact on our immune system. And it happens to often suppress our immune cells, which is why glucocorticoid steroids are often used as pharmacological agents. But anyway, the zona fasciculata is going to be the group of cells which produces the glucocorticoids. And so these levels are going to be ultimately what determine the release of glucocorticoids within the blood. And so let's say we have a stimulus that decreases our level of glucocorticoids. Well, that's going to be picked up by receptors in our hypothalamus, and then that in turn is going to lead to the release of corticotropic releasing hormone, which then stimulates the corticotropes of the anterior pituitary to release ACTH, and then ACTH will lead to increased secretion of glucocorticoids throughout the bloodstream. If the opposite were to happen, well, then you are going to get the opposite effects to eventually lead to less glucocorticoid release. The adrenal cortex is also partially responsible for regulating our levels of estrogen and testosterone. And so it creates the precursors for these two hormones. And one of the major precursors is dehydroepiandrosterone, which again is just a precursor for these sex hormones and plays a major role in the levels and the concentrations of these two hormones. The chromaffin cells of the adrenal medulla are going to synthesize two of the catacholomines that we discussed when talking about the sympathetic nervous system. And those are norepinephrine, which we know is also a neurotransmitter released by sympathetic neurons, and epinephrine. And so when these get released throughout the bloodstream and bind to their targets, they're going to increase sympathetic nervous activity. The pineal gland located in our brain is going to play a huge role in our sleep and wake cycle. And it does that by producing what's called melatonin, which is derived from serotonin. And so in response to the amount of light and what time of day it is, we're going to secrete more melatonin in order to try to start and regulate our sleep cycle. We can see that the levels of melatonin are going to be regulated by the amount of light or what time of day that it is. And so during the daytime, that sunlight's going to inhibit melatonin, while at nighttime, that darkness excites the production of melatonin. And then that pineal gland is going to generate and release melatonin, which helps aid in, again, our sleep cycle and our our drive to go to bed. And so a lot of recent research has shown about the effects of our electronics and how those lights, looking at those lights before we go to bed, can impact our sleep cycle. And so, that inner working, that's, how we've sort of regulated our sleep cycle for years upon years, but now we're having this adaptation that's occurring that's disrupting our homeostasis and impacting our day-to-day lives. Let's move on to another organ within the body called the pancreas, and a major role of the pancreas is going to be determining the levels of blood glucose within our bodies. And so you have these cells located within the pancreas, and the two major ones we're going to talk about are alpha and beta cells, and these are going to release hormones which regulate our glucose levels. But a lot of other digestive enzymes stem from the pancreas and are going to help in our overall metabolism. Alpha cells of the pancreas secrete what is called glucagon, and beta cells of the pancreas secrete what is called insulin. And as we're about to demonstrate in a second, these two hormones will regulate our blood glucose levels. Delta cells secrete a hormone called somatostatin, otherwise known as growth hormone inhibiting hormone. And we talked about it or mentioned it briefly with the hypothalamus, but actually somatostatin plays a role in impacting digestion. It actually slows down digestion and also slows down the secretion of glucagon and insulin. And then we have F cells, which secrete pancreatic polypeptide, which also influences our digestion. Diving into how the pancreas will impact our blood glucose levels, let's first talk about the function of insulin and glucagon. You've probably heard insulin before because many in this country are, either pre-diabetic and diabetic, and so the medication insulin is, commonly used by a lot of people in this country and across the world. And so why is that? Why do those with diabetes take insulin? Well, first let's discuss the actual role of insulin, and then we can discuss what happens once we have type 2 diabetes. And so normally the hormone insulin will bind to insulin receptors, and what it does, it starts this pathway which allows these GLUT4 transporters to go to the plasma membrane. And then once those GLUT4 transporters are located on the plasma membrane, that allows for glucose to come into the cell. And so normally this glucose can't just cross that lipid bilayer. And so when insulin binds, it promotes these GLUT4s to travel to that plasma membrane, and we're going to get a decrease of glucose in the blood and an increase in glucose within our cell. When insulin binds, it not only increases the uptake of glucose, but it also increases the uptake of amino acids and fatty acids, and will lead to the formation of glycogen, triglycerides, proteins. And so basically insulin is an anabolic hormone. It's going to help the cell bring in all these materials, and we're going to synthesize bigger structures from those glucoses, from those amino acids and those fatty acids. Glucagon is going to serve the opposite function. When glucagon binds to its receptor, it's going to lead to a signaling pathway which breaks down glycogen in our muscle and liver cells. And once that glycogen is broken down into individual glucoses, GLUT2 transporters located on this membrane will shuttle this glucose from inside of the cell to outside of the cell and into the bloodstream. So we're getting less glucose inside of our cells and more glucose within the bloodstream. Glucagon is going to be a more catabolic hormone, and so it's going to break down glycogen to get those glucoses into the bloodstream. It's also going to help in the synthesis of glucose from non-carbohydrate sources, also called gluconeogenesis, and it's also going to lead to the breakdown of lipids and slow down protein synthesis. So again, insulin, more anabolic, we're getting more glucose uptake, and then glucagon, more catabolic. We're getting more glucose release into that bloodstream. So here we see how those glucose levels are regulated. When we have hyperglycemia, high levels of blood glucose, we're going to release insulin from those beta cells of the pancreas, and that will promote the uptake of glucose into our cells, lowering blood glucose levels. But hypoglycemia, low blood glucose levels, will then lead to alpha cells releasing glucagon, which does the opposite effect. It will break down glycogen within our cells, and then those glucoses will be released into the bloodstream. Just want to make quick mention of other tissues that will produce hormones. The skin will use the rays of sunlight to make cholecalciferol, or vitamin D. And so we know that vitamin D is important for immune function. And so the skin is able to convert that sunlight into vitamin D. The thymus plays a huge role in our immune response, and we'll talk more about that in future lectures. The heart can produce something called natriuretic peptide, which actually decreases blood pressure. More to talk about that in the cardiovascular system. And then the liver as well is also responsible for synthesizing vitamin D, or 25-hydrocholecalciferol, and then also secretes thrombopoietin, which is responsible for the generation of platelets within our bodies. Many of the digestive organs will create enzymes to break down food, but can also produce signaling hormones in order to influence the activity of the digestive system. The kidneys will produce what's called calcitriol, which influences our calcium levels, and also erythropoietin, which is otherwise known as EPO, which is responsible for the production of our red blood cells. Adipose tissue, or our fat tissue, will secrete a hormone called leptin, which influences our hunger and our drive to eat. And then the placenta as well are going to provide many signals that promote the growth of a fetus and the growth of a child when a woman is pregnant. An outcome of producing more growth hormone is going to be the growth of our bones. And so this occurs especially during puberty, when we see growth spurts that occur and people shoot up in height. So bone length will occur at a place called the epiphyseal plate, or the growth plates. But bone thickness can be changed by many different factors and can be influenced at any age. And so bone thickness is going to be regulated, and the bone matrix is regulated by two groups of cells. One are called the osteoblasts, which are actually going to build up the bone. They're going to help form this matrix and increase our bone thickness. And osteoclasts are going to destroy this matrix and decrease our bone thickness. So these two groups of cells, they have opposite effects. Osteoblasts help form the bone and increase thickness, and osteoclasts break down the bone. It's important to note that even though osteoclasts will absorb old bone and help break down the bone, they are vital in both bone growth and bone repair. So we see this many times in injury and damage, that you need groups of cells to remove old or damaged cells, and then groups of cells to help form new cells. At the growth plate, or the epiphyseal plate, we could see that these chondrocytes are going to multiply and divide. And so as those chondrocytes get older and they mature, old chondrocytes then are replaced by bone. And so that's how we get this growth, this length change in our bones. So we're going to see that we are going to have increases in growth hormone and sex hormones like testosterone as we are growing older, especially during puberty. And that's going to lead to the growth spurt that occurs as we are teenagers. And so these hormone levels play a role in the size of our bones and our bone thickness. But what happens is, as we get older, those levels of hormones start to decline. And a lot of times, your bone density is going to decrease as you age. And that breakdown leaves older people more susceptible for injuries. And since they have an increased risk of falling, that's why you see more occurrences of broken hips and things like that in an elderly population. And so anything that helps promote these hormone levels or, strong bones, it's encouraged. And that's to hopefully prevent serious injury from occurring. And how do you influence the thickness or the size of your bones? Well, one is always going to be genetic. The levels of minerals like calcium that you consume, vitamins as well. Your vitamin D will help promote strong bones. As we age, we just discussed that we have different levels of hormones that can influence our bone growth. But a very important one is exercise, and that's the one that we can really influence there. And so a lot of resistance training activities and plyometrics seem to increase bone density, and just promoting an active lifestyle overall will promote and lead to increases in bone density in those who are active. To close out this chapter, we are going to talk about stress. And so when most people hear stress, they think about distress, which is harmful stress. But we can also encounter stressors that are helpful, and this is called eustress. And so anything that brings about a stress response is going to be called a stressor. So just like a stimulus within our bodies, these stressors bring about disturbances within our bodies, and hormones get released in order to deal with these stressors. The stress response is typically called the general adaptation syndrome. And what happens is we have a phase when we first are introduced to a stressor called the alarm phase. And during this phase, many hormones are going to increase, and sympathetic nervous activity during this alarm phase increases. And so then once we have faced that stressor, for as long as that stressor is there, then we have the resistance phase. And so we're going to have, these hormones and continue to be released during this resistance phase. But what happens is that if these hormones are secreted over long periods of time, we can have what's called the exhaustion phase. And, these hormones that are released during this stressor, during this stressful response, are going to lead to breakdown. And so, that can impact the body's immune response, and again, lead to exhaustion. And chronic stress can ultimately lead to disease. And that's why, stress is a silent killer. And so we as health professionals have to try to promote all things that reduce stress and promote good stress. So, exercise for one, eating better, sleep habits, maybe meditation, positive thinking. These are things that can actually improve the health of individuals based on, their hormone levels. So the stress response, again, is going to bring about an increase in sympathetic nervous activity. In addition, it's going to lead to the increase of cortisol, T3 and T4, and that's going to lead to increased metabolic rates. Again, we're trying to fuel this fight or flight response, this stress response, so we need these cells to create energy quickly. So we're going to see increases in lipolysis, the breakdown of fat, gluconeogenesis, the breakdown of glycogen, and then just overall, we're going to get a breakdown, of these nutrients, of glucose, of fatty acids in order to produce ATP. That will conclude this lecture on the endocrine system. So today we talked about all the different organs that make up the endocrine system and the different types of hormones that we release in response to certain stimulus. We talked about bone growth, and then we talked about stress. So I want you to go over those and, try to really key into what hormones do and what their functions are and what effects they have on our body. Thank you guys so much, and I'll see you next lecture.